Do you suffer from severe headaches, or do you know somebody who does? Maybe they come randomly or happen on a frequent basis. Maybe they change your mood or your behavior, or even ruin your day. Maybe they even change your appetite and how much you sleep. Well, there could be a number of reasons why a headache is occurring. We always turn to medication when we are in pain, but medicine is not always the answer. According to some neurologists, treating a headache without the use of medication can sometimes give a patient more relief, and a lot of times it can be more convenient for some people. Now, I suffered from a brain injury in 2007, and I now suffer from severe headaches. Surgery is not an option for me, so I turned to medication as my cure. I quickly came to find out that there was other ways to treat a headache without the use of medication. Now, when you have them as frequently as I do, you learn to cope. So, I learned that the exercises and the treatments without the use of medication can sometimes be more effective than with medication. Now, if you can't even enjoy spending time with your friends or your family, or even do the things you love without having a headache, then I really think that this talk will give you the opportunity to look at some of the treatments that could help you have better days ahead. Today we are going to talk about the different types of headaches and how they can affect a person and how you can treat them without the use of medication. Let's first start talking about a tension headache. Now, a tension headache is like a mild headache. Now, these are the most common in some people. They are not as severe, but they can still be treated, and they can still be a little bit painful. First, without the use of medication, you're going to want to put a warm rag on your forehead. This will expand the blood vessels around your brain. Also, you want to go lay down in a dark, quiet room, which also always helps. Now, these headaches don't usually worsen by light, smell, or sound, but they are triggered by stress or trouble sleeping, eye strain, or neck pain. So all of this want to be consideration when you're trying to treat this headache. Now, a tension headache affects the frontal lobe. So you're around the frontal lobe, and the cerebellum is where you're going to have the most pain when you have a tension headache. The cerebellum is connected to the spinal cord, and that is why a tension headache is associated with a neck pain. Illnesses on the body can also give you a headache, and these are going to be called a sinus headache. Now, allergies are the biggest reasons for these headaches. So clearing your nasal passages will give you the most relief. Additionally, after reading up on the WebMD, the Migraines and Headaches Health Center, according to a couple doctors, keeping your sinuses moist will relieve some of the pressure on your headache. So taking a hot steamy shower or using a humidifier will help loosen up some of the mucus and debris that's stuck inside your nose and open up your airways. You also want to stay hydrated, so drinking a lot of fluids will also help some of the stress that's on your head. A lot more of this information can be found at www.webmd.com/migraine/headache. Some of you wonder, and by the way, the sinus headache will affect the frontal lobe, because the sinus headache occurs around your eyes and your temples and your nose, so it'll affect more around the temporal lobe and the frontal lobe. Now, some of you wonder, what if your headache becomes more chronic? Well, these headaches are going to be called a migraine. Migraines become more severe, and they are harder to treat. Now, according to the Treatment and Healthcare Satisfaction Among People with Migraine Headaches by Joanne A. McKell and Diana D. McDonald, an article on the Quality of Life Research 2001, states that migraines affect an estimate of about 11 million people in the U.S. Migraines can be triggered by stress, alcohol administration, skip meals, or even more. Now, when you're trying to treat this headache, you want to use a cold rag or an ice pack instead of heat. You also want to massage around your neck, around your temple, and this can be used as a relaxation technique. You also always want to go to a dark, quiet room, of course, and so you can avoid the loud, noisy, and bright surroundings. Now, your migraines associate with the entire brain. The migraines, when you feel more throbbing on one side of the brain, that's when you know you have a migraine. We have the opportunity to lower the rate of headaches by some of these quickly daily routines, which I find really interesting, such as drinking grape juice or caffeine, which is usually a quick pain reliever. And when you can add herbs to your daily meals. So peppermint and ginger and cayenne are known as natural pain relievers when it comes to headaches. Also, when you find pressure points on your body, it can also alleviate some pain on your head. And from personal experience, you can also use Johnson Soothing Vapor Baby Bubble Bath, which is good to bathe in when you're trying to relieve a headache. So more of this can be found at www.home/remedies.wonderhowto.com/get-rid-of-a-migraine-fast. So now that we have learned some possible ways to treat headaches, such as tension, sinus, and migraine headaches, without the use of medication, I really hope that you found this talk very, very effective. I am not saying medication is bad to use when you are at relief, but I'm just saying that some people may not have that option because of health history or maybe because of finances. So healthcare professionals find diagnosis and management of headaches difficult, and they worry much about missing rare serious causes according to the article guidelines, diagnosis and management of headaches in adults. So I really, really, really hope that you find that this will change your outlook on treatments and headaches. Maybe it'll surprise you at how effective these little steps without the use of medication can change your life. Thank you.